Hi, my name is Max Frizzlum, and I'm a criminal defense attorney in Maryland. If you're watching this video from outside the state of Maryland, I recommend you consult an attorney in your local jurisdiction, because the DUI laws across America are different in each state. Today's video is going to discuss the two different types of drugged driving charges that you might receive in the state of Maryland, what makes them different, and what their maximum penalties are. Much like my last video on the differences between DUI and DWI, the primary focus is going to be on the legal differences and the differences in terms of punishment. What are the two offenses? The first of which is driving while impaired by a controlled dangerous substance. The second charge would be driving while too far impaired by drugs, one or more drugs, or drugs and/or alcohol. How do they differ? Well, the easy way is they differ in maximum penalty. Driving while impaired by a controlled dangerous substance carries a maximum penalty of a year incarceration, a $1,000 fine, and 12 points on your license. Driving while impaired by drugs and/or alcohol carries a maximum penalty of 60 days incarceration, a $500 fine, and 8 points on your license. What makes them legally different? What makes them legally different is the burden that the state of Maryland is going to have to prove in a case against you to either a judge or jury. What do I mean by that? Well, in a controlled dangerous substance, driving while impaired by controlled dangerous substance case, the state needs to identify the specific substance that you were under the influence of, and then needs to show that that substance was in fact a controlled dangerous substance. What is a controlled dangerous substance? Well, for that, you'd have to look at the schedule in Maryland's criminal law article, but some common examples include things like heroin, cocaine, fentanyl, but also some prescription medications like alprazolam, Xanax, high oxycodone, morphine, and even marijuana. The reason that I bring up marijuana is because possession of under 10 grams of marijuana is in fact only a civil violation. Having said that, marijuana is still a controlled dangerous substance in Maryland, and possession of over 10 grams is criminal. Today, while I'm making this video in February of 2022, the Maryland legislature is contemplating putting on the ballot potential legalization of marijuana. So things might change on that front. However, drug driving laws in Maryland, currently marijuana is a controlled dangerous substance. So, back to what needs to be proved in a driving while impaired by controlled dangerous substance case. 1. Driving or attempting to drive. 2. Impairment of normal motor coordination due in part to a specifically identified controlled dangerous substance. How do you identify which controlled dangerous substance a person was affected by? That would be the job of a drug recognition expert and probably a scientist who tests some blood. What is a drug recognition expert? A drug recognition expert, or a DRE, is a specially trained officer whose job it is to identify what substances a person is affected by based on advanced field sobriety testing. These are not the average patrol officers who hand out many of Maryland's DUIs. They're specially trained and they're limited in number. What usually happens in a drugs driving case, that an officer believes someone's under the influence of drugs, they'll request a DRE either to report to the scene or bring the actual suspect to the DRE's office, and the DRE will conduct a number of tests. DREs conduct far more tests than the typical big three we see in terms of standardized field sobriety. They'll conduct horizontal gaze nystagmus, which you do see in DUI cases, the walk and turn, which you also see in DUI cases, but they'll do additional testing, the modified Romberg, which would be holding your head back and counting. We see things like a pupilometer to measure the size of pupils. We see body temperature actually tests. We see reaction to light tests. We also see heart rate testing. There's an exhaustive panel that a DRE usually puts a suspect through, voluntarily, of course. In addition to that voluntary testing a DRE will ask the suspect to perform, they often ask for a voluntary blood sample. Now, that voluntary blood sample is going to be important for a few different reasons, because it is considered a test in the same way that a breath intoximeter test is considered a test. So refusal to perform it could result in license suspension. If you do not perform that test and the DRE has to reach an opinion about what type of substance you're on, they do usually identify a category of drugs that you could be impaired by. For example, CNS depressants is a very common category that a DRE will identify. How do they exactly do that? It's an interesting science, and it's something that a qualified attorney is going to have to question that specific DRE on in the course of a trial in your case. So, backtracking, we have what are the elements of controlled dangerous substance impairment driving case? Driving or trying to drive, impairment of normal motor function or coordination by a controlled dangerous substance, proven through maybe a DRE, maybe a blood test, maybe both. How does that compare to driving while impaired by drugs and or alcohol? Well, in a drugs and or alcohol case, the difference, and the reason there's a lesser penalty probably, is because the burden of proof is lower. The state does not need to identify specifically what controlled dangerous substance was affecting a person